Exercising while you're driving. What? So, some people go, what? Exercising while you're driving? Are you kidding me? So you're either slacking while you're driving, slumping while you're driving, sitting while you're driving, or working your muscles while you're driving. So between you and I, actually working my muscles in a good way is my idea of driving. So I can be very safe while doing some small minor things to increase my ability to stay neutral through my spine. So if you look at my shoulders right now, I'm kind of slumping. A lot of people use their right hand to drive. You've got an armrest here on the left, which you could lean on, which isn't good. So I want you to get nice and straight. If I squeeze my shoulder blades together and relax and squeeze and relax and squeeze and relax, in a few minutes I can get 20, 30 shoulder squeezes in. You can do 3 sets of that. It takes a couple minutes. I can also stretch my shoulder. So if I want to get a shoulder stretch, I can put it behind the passenger seat while taking nice deep breaths to get a pec stretch, which is very beneficial. A lot of my patients just don't know where to take extra time to actually squeeze exercises in during the day. And most of us drive. So imagine getting your stretches and exercises in on the drive. Pretty awesome. I will stretch my forearm. So being able to breathe and just push against the dashboard. Very easy stretch. So now I can get my shoulder and my forearm. So that's the shoulder series while you're driving. The other thing is chin tuck. Some of my patients literally are driving to their appointment after they've had a car accident. So chin tucks are really easy. I can push my head back into the car seat. I can push into my left hand. I can push into my right hand. I can push forward, working each angle of my neck muscles, which is really important. Chin tucks are where you lightly bring your chin back and work on centering the neck. So a lot of people think this is centered, okay? When the chin comes forward, you can literally hear this in my voice, the strain that it puts on the anterior part of the neck, and then these muscles get really upset. So chin tucking is very important. So that's the neck portion of working on the car. Now, for the lower back, if I have a purse or pillow or something behind my lower back, I can do Kegels while I'm driving, right? Kegels are easy. You tighten your pelvic floor. So basically, I tell my patients, you can sit like you're peeing on a toilet, or you can sit like you're done peeing on a toilet. So when you're sitting, you want to engage the pelvic floor, relax, engage the pelvic floor, relax, engage. I mean, you can do 3 sets of 50, you can do 150 a day. Very important. You wouldn't believe how many seatbelt injuries across the lap that I see where people have incontinence with car accidents. They don't want to talk about it with their doctor. And I'm pretty sure people want to walk around without peeing their pants. So this is extremely important. Great exercise to get done in the car. I don't know a better place to do that. And then the other thing sitting is knee squeezes. So particularly for my disc herniations. Now listen, after you sit for 10 minutes or more, your hamstrings and glutes can just turn off, right? You're not using them, you have your full body weight. So then we end up becoming really thigh or quad heavy. So if you take your fist and squeeze your knees together, or even better yet, if you want to be safe, if you have a pillow or an item, or just squeezing the knees together, it's better to have something there to have a little bit of a space. And that is very safe, right? Because you can have both hands at the wheel and you can be squeezing the knees together. What that does is, and what you'll feel is your glutes and your hamstrings engaging when you're sitting. And you can be watching the road, full access to the brake, knowing what's going on the whole entire time. So that's our exercises for the lower back. So literally you can work your neck, your shoulders, and your lower back while driving in the car, having half of your postural exercises done when you get home without interrupting your daily schedule at all. So get on your exercises. Aloha.